So the steam treatment for the prostate is one of the treatments available to treat lower urinary tract symptoms that have become bothersome. By that, I mean that a lot of people would live with a slightly slow flow and incomplete emptying of bladder, and this will not affect their quality of life. It is when it starts affecting your quality of life, you're waking up in the night, you're having to plan your journeys, you're looking for toilets when you are traveling, for example, driving long distances. And that's when all your sleep is being interrupted because you're having to wake up very frequently. And that's when people would want to seek help. So steam treatment, so there is laser treatments, there is traditional treatments where you have shaving off the prostate or coring out of the prostate. There is implants within the prostate that can help to shrink it or widen the passage for the wee to come out. However, steam treatment has been revolutionizing in terms of preservation of the sexual function as well as continence control. And that's why it's gained popularity. It's minimal access as well. It's all done through the urethra. And there is minimum disruption. It can be done as day case. In fact, it is done as a day case. And you have a very short period of catheterization for up to 3 days, maximum up to 7 days. And it preserves the sexual function and your continence control. There is no risks, major risks in terms of having any severe bleeding or having a catheter in for a longer period of time. And there is minimum disruption to life. These are the positives about it. How it's done through the water pipe or the urethra. The camera goes in and there is few injections of steam depending on the size of the prostate. It does make you feel a bit urgent and frequent to begin with for first week or two, but it all settles down in time. It works slowly by letting the urethra, the prostate part of the urethra, open up so there is less resistance for the wee to come out. And that's where it's gained popularity because of the minimum disruption and preservation of sexual function and your continence control, which is very important for majority of the men. So if you look at the data, there is up to 4% retreatment rate within 4 to 5 years. However, majority is fine. Looking at the current literature on Rezum or steam ablation or steam treatment of the prostate, it's safe to say that it's a widely accepted and very successful treatment. It's not 100%, and there may be some individuals who will go on to have further treatment or may not be able to come off their medications, but that's a minority. Majority will be able to stop their medications, such as stemcelation and finasteride, to relax the bladder neck or to shrink the prostate with all the side effects involved. So that's another positive that allows men to consider Rezum or steam ablation of prostate. Thankfully, there aren't any major risks. It does involve interference with your normal day-to-day life, coming into the hospital, having the procedure done as a day case. You can go home the same day, and one has a catheter in for 3 to 7 days at the most. The risks are infection and bleeding, although minimum, these are there and to be considered, and a short course of antibiotics may be required after the procedure. Analgesia or painkillers are often needed. Once the catheter comes out, majority feels a little bit urgent and frequent for a week or two, but that settles down on its own accord without any further intervention. There is a small risk if the prostate is sizable, that the first trial without catheter may not be successful and may have to have a catheter back in for another 1 to 2 weeks, and that comes out, but that's in practice quite a rarity. Thankfully, there is no major risks involved in this modality of treatment. No single modality is suitable for all. And that's why it's important to see your specialist, to have an assessment, and to consider whether this is the right treatment for you. It may be that your prostate is more suitable for a laser treatment, and there is different types of lasers, or a traditional transurethral resection of prostate, or in other words, shaving or coring out of prostate, or you may just require medication alone. So that's where it's important to have an assessment and understand as to what treatment would be best for you. Majority of the times, for most men presenting with lower urinary tract symptoms that have started to affect their quality of life, this is this treatment that can cater for them. Certain size, if it's gone beyond a certain size, the prostate is, and it's enlarged beyond a certain limit, this treatment may not be effective. And that's where the laser treatments will come into play.